Hi guys, thanks for joining. This is Dr. Sammy with Eastwood Animal Clinic. We appreciate all you guys. And we're going to answer some of those questions that y'all posted on the different media platforms. The current question that we're addressing today is older dogs and kidney disease. Basically how to treat it and how can you prevent it. Very good, legitimate questions. So good job for asking a good question. So, a little bit of a loaded question. There's not necessarily a simple 100% guaranteed answer for all those, and every patient is different and has their own needs and a lot of different predisposing factors. So it does vary, but the best way to prevent those things is you gotta look. You gotta identify it early. There is no real way to 100% prevent it that I am aware of. There are some outside thoughts where, diets, things like that. Diet is a major treatment in kidney disease in both canine and feline, in actually most species. So diet is a huge role, but it's not necessarily something we do proactively. Now, every doctor is different, and we'll touch on that here in a little bit. So trying to kind of diagnose it, the only way to diagnose that I am aware of is through diagnostics. Typically, doing blood work is how we look for it, and we look for specific enzymes called creatinine and BUN. There are some other indicators that we can look for. Other ways you can kind of look for it is through a urine sample. With urinalysis, we look at urine concentration, protein levels, sugar, various things that are in that urine. A newer thing that's been out for a while that we use all the time is called an SDMA test. And here we have that built into our general profile, and what that does is it's supposed to identify kidney disease about 20-30% faster than just traditional blood work, aka just the creatinine and BUN. There are different levels within kidney disease, typically graded from 1 through a 4, 4 being the worst. I think we have that on another video where we don't have time to go into those details today. So the best way to be preventative with that is once your patient is crossing over into that geriatric realm, depending if you're a small breed, large breed, dog, cat, that age changes a little bit. For my traditional small breed patient, so 20 pounds or less, most of those guys, their average life expectancy is around 13, 15 years of age. I do have patients get much older, and some not quite make that 15 years. I usually recommend once a year blood work with your veterinarian once they hit about 7 to 8 years of age, and then we can catch those problems at the very beginning. When we catch them, we put you on a prescription diet. Every doctor has their own preference. I use a lot of KD. Every now and then I'll have some owners who are more motivated and they want to do home cooked diets because they read things, saw things, have different perspectives, different opinions. Great. A lot of times that is more expensive actually, and it takes a lot of time and prep. I do not encourage you to do that on your own and by yourself. That is a terrible idea, and we see a lot of macro and micronutrient deficits and other issues develop from that. So, ideally a nutritional specialist. In El Paso, where I'm at, I don't have a lot of specialists around the corner. Some of those are available for phone consults. I have had a couple of nutritional specialists recommend balanceit.com, and then they have specialists who help formulate diets for your pet's needs. It used to be free. I think there is a charge now though. You'd have to look into that for a little more details. So that's probably the best way I could tell you is just look. There's no real way of just looking at the patient until they have advanced disease. But if you're trying to be proactive and catch it early, you just start looking with blood work early. I usually relate that to people, males and females. People, there is a certain age where you start getting pap smears. On males, there are certain years and ages where they start recommending routine prostate exams. Kind of the same in our world, just we're going about it a little bit different. So hopefully that answers some of those questions for you a little bit, and we'll kind of go from there, guys. So be safe and take care. Bye.